Hi everyone, my name is Anthony and welcome back for another virtual Lunch and Learn. Last week we spoke about nutrition and this week we have another two-part presentation talking about posture and neck pain. This presentation is meant for educational purposes and should not be interpreted as medical advice. Part 1 of our presentation here will start us off with posture and we hope you enjoy. Let's take a moment to look at this picture. Each person here has the potential to improve their posture. Now let's take a moment to look at how you feel. What message is your posture trying to communicate with you? And what is it trying to communicate with others? Slouching and slumping may not only lead to back pain, but can also connect to things like energy, confidence, and openness. Posture refers to how you hold up your body. It is important to remember that there are two different types. Static posture, such as sitting, standing, and sleeping, as well as dynamic posture, such as when moving. Let's learn a little bit about your spine. Your spine is your body's main support structure and has three natural curves. The first curve, found on the neck, is the cervical spine, which contains 7 vertebrae. The second curve, found in the middle back, is the thoracic spine, which has 12 vertebrae. And your low back, or your lumbar spine, contains 5 vertebrae. Your posture, or how you hold your spine, can either prevent or cause pain. Now let's test your knowledge. True or false? Good posture means keeping your back as straight as possible instead of slouching. False. Correct posture maintains the 3 curves of the spine, but does not over-exaggerate them, which in turn helps prevent pain and injuries. Some risks of poor posture. Poor posture can affect your health in several ways, such as increased pain in the back, neck, shoulders, arms, and legs, decreased flexibility, poor balance, increased risk of falls and injuries, which can be related to balance, strength, and flexibility, impacts to other bodily functions such as breathing and digestion, as well as increased fatigue due to the body not moving efficiently. Some tips for good posture in the standing position. Maintain a neutral spine. Don't over-exaggerate your stance and avoid military at-attention postures. Keep your chin level with the floor. Keep your head balanced over your shoulders. Ears, shoulders, hips, knees, and ankles should all be aligned. Keep your feet about shoulder width apart for balance. Avoid locking your knees. Keep them slightly bent. And slightly contract your ab and glute muscles to support your spine. Some tips for posture when sitting. Keep your shoulders back and relaxed. Keep your hips and knees about approximately level, or your hips can be slightly higher than your knees. Support the natural curve of your low back. Either use the lumbar support features of your chair or a rolled towel placed at the curve of the low back. Both feet should be fully supported on the floor or in a stable footrest. And when turning, turn with the whole body rather than twisting at the waist. Also, make sure to take breaks from sitting by getting up and moving every 30 or 60 minutes. It's also important to remember that if you're working at a computer, to consider your monitor height. The monitor should be adjusted so the neck is aligned with the spine to prevent neck pain. Let's test your knowledge again. True or false? Standing all day at a standing desk is better than sitting all day. False. Even though standing desks are popular, prolonged static standing can cause back pain as much as prolonged sitting. It is also possible to have poor posture when standing at a computer. It's just important to remember to keep moving and to alternate postures throughout the day. A general rule of thumb is to stand for about 15 to 20 minutes and sit for about 40 to 45 minutes every hour. The benefits is in changing positions. However, it's important to note that you may be a little bit different, and for you the best combination could be 25-35 or 30-30 or anything that you find most comfortable for you. It is important to remember that sleeping is also a good time to focus on your posture. When you're sleeping, use a pillow that contours and supports the neck and keeps the head aligned with the spine. When you're on your side, a pillow between your knees may also help increase comfort and help keep your spine aligned. It is also important to remember not to put your hand underneath your pillow, as it can take your head out of alignment. You can also put a pillow underneath the armpit of the top arm to help with increased comfort and to reduce twist forces on the spine. If you're sleeping on your back, a pillow underneath your knees may also help reduce pressure on the spine. And it's best to avoid sleeping on your stomach, which tends to increase back and neck pain. If you do sleep on your stomach, use a pillow underneath your stomach and a pillow underneath your ankles, but no pillow underneath your head. You can put a pillow underneath the mid-chest area if it also helps keeping comfort and to reduce strain on the neck. Here you can see the ideal and non-ideal areas to perform work around your body. We want to focus keeping work within our reach zone. This will help to reduce stress on the neck and the entire back, along with the shoulders and the arms. And it happens by keeping your work close to the body and within the preferred range. Work can include lifting things such as heavy loads, but this also applies to sitting as well. Some tips for good posture when lifting. Before lifting, assess the situation, such as the size and weight of the object, where you're starting and where you're going, and if it exceeds your ability to safely perform the lift, ask for help. If you do choose to perform the lift, stand close to the object with your feet shoulder-width apart, and make sure you have safe and firm footing. Then squat and bend at the knees, not at the waist. Secure a firm grip on the object and pull it as close to your trunk as you can. Next, tighten your ab muscles and slowly lift, using the legs, not the back. Carry the object close to the body and at waist level. When turning, pivot your feet, do not twist at the trunk, and follow the same process for lowering the object. If you do have issues such as knee pain or hip pain, it may be more beneficial to ask someone before for help and then to also ask for guidance when lifting heavy objects. Some small ideas for some next steps. It is important to remember to get up and move, and setting a reminder may help you accomplish that goal. Also, always practice lifting with proper technique, even with light loads. When sitting, use a rolled towel to support the low back if your chair does not have lumbar support. And focus on working within a safe reach zone at all times. I want to thank you all for joining us for part 1 on our discussion about posture, and we look forward to seeing you in part 2 in our discussion about neck pain. If you ever have future questions about your health and fitness journeys, you're always welcome to stop in at our office, and we would love to have a conversation with you. Thank you.